Our set is working on an NVQ for MLAs, that's medical laboratory assistants. It's been needed for a long time and we're very pleased that that is coming into place.
It's very helpful in an action learning set to have an appropriate variety of people from different backgrounds and disciplines who can throw light on a problem.
I'm very used to a structured way of working, a formal type of meeting where people come wearing certain hats, and this was an entirely new way of working where different people are getting together to solve a common problem or maybe not be able to solve it, where everyone's treated as an equal, where you have to have a lot of trust in people to take actions in between meetings, which in the normal way of things they would have to do by virtue of their position, but they aren't actually having to do in an action learning set.
On our set we have 2 palliative care consultants, we have 1 renal consultant, we have a renal specialist registrar, we have a social worker, specialist nurses from renal and palliative care. It's not just another meeting because there isn't any agenda, because there isn't any hierarchical structure. It's just sitting around a table and you can actually wear your heart on your sleeve and discuss anything positive or negative about any actions you were left to do or any actions you didn't have a chance to do. Nobody's going to penalise you.
I think there are 2 major benefits of action learning. One is it helps you do those things which you think are important to make things better. That's the action bit, if you like. And the other thing is what you learn as a process out of that. So you learn all sorts of things about your profession and your professional area of work, but you also learn a lot of things about yourself as a person.
The action learning sets has actually allowed us to go away and think about other ways of dealing with renal palliative care issues, and listening to what other people have actually said and them allowing me to speak and lay the cards on the table. We've actually now started to look at developing renal palliative care clinics at Manchester Royal Infirmary. One of the other things that's allowed us to do, being in the action learning set, is to link in with other specialist teams. So there are professionals in the set that gave us names or people that we could actually contact that would allow me to network with specialist teams outside in the community that could help us at Manchester Royal develop our renal palliative care pathway. I'm a very clinically based nurse, if you like, really. My job and my passion is hands-on, working with the patients at the patient's level. I feel that sticking with the patients, learning from the patients, being the patient's advocate, that I can take all that I learned from the patients further up the ladder.
It's certainly true in my experience that the only people who really take action on issues are those who feel responsible for them. Unless you feel responsibility for doing something, for improving a service or getting a better patient outcome, then you're not going to take action. And so that's the really important thing. You don't need to have the answers. They can be provided in the set and learned as a result of taking action.
When I was asked to look at what I would like to do for an individual project, I had this one ready and waiting. If the phlebotomists work in A&E, we hope to make the turnaround time for patients' treatment quicker. The phlebotomist will get the blood done as soon as the patient gets there and is triaged. The action learning set has backed me up. I found the consultant in the A&E department was absolutely marvellous and supported my idea wholeheartedly. They did actually find us some money, so for 3 hours a day, 5 days a week, we're going to run this service for 3 months to see how it goes.
Action learning has allowed people to look at things from a new perspective. Rather than say, these are the only ways of doing things, we've been able to take time to explore things that we probably wouldn't been able to do before. We've been able to deal with some quite difficult issues which might not be expressed otherwise. For example, should all patients be eligible for transport? Should patients have to pay for transport? Some of those things might not have been touched on in a more formal way of working because they might have been seen as too difficult to deal with.
People often say that the best thing about action learning is that they don't have anywhere else they can come and talk about these issues in quite the same way as they can here. It's a very empowering experience to be properly listened to about something that you're finding difficult but you really care about. And I think it's that basic process of being listened to and being helped to come to some suitable next steps that you could take that gives people the confidence and sense of power to go out there and do them.
I think it's been a very worthwhile and positive experience. I came to it with some trepidation. We were dealing with a very difficult issue with raised expectations, but we've all wanted to make it work. We've all had the commitment to it. I hope we will make it work, and I'm sure we'll all go away from it able to take the experience into other areas of our personal and professional lives.
I think what the Action Learning Set has done for me is help me believe in myself. So these people are giving me the confidence in the set to think that's a good idea. Why don't I go away and try it?
The whole thing has given me the chance to change things and to make things happen.